I was born in Iran to a wonderful, loving family. Sadly, the revolution happened and we had to flee. We didn't think we would have to be gone for a long time, but of course it's been over 35, 40 years now. We moved around quite a lot. Eventually, we came to the US. I went to law school, met my husband in California, and then moved to Houston. And I've been living here for over 30 years. I have 2 beautiful children, and just so grateful about how this city and this state accepted us and helped us flourish. So what I've done since I've been here is really try to give back to the community and make sure that everyone else has the same opportunities that were given to us.
Sima is an incredible woman. Her life's work is to pay it forward, reach down to help other women who are reaching for the stars and their children, to lift them up along with her.
If you would believe it, up to 36 years ago, women were not allowed to take business loans without a male co-signer. The National Women's Business Council came into existence in 1988 by a law called the Women's Business Ownership Act. I've had the honor of being appointed to be chair of the NWBC, and our main purpose is to advise the President, Congress, and the SBA on what it is that will help women flourish and become entrepreneurs from beginning to end. Our concentration is on access to capital, access to opportunity, and making sure that underserved communities have what they need. To me, women are the center of everything. I strongly believe that if we equip women with affordable housing, good jobs, just the resources they need, children will strive, the community will strive, and it will just be a better place to live.
Sima's work extends beyond the business sector. We can't rise if our kids are not healthy, if our women can't access adequate health care, and she's been in the forefront of making sure that that's possible.
As she's trying to address the really important non-medical determinant of health, including home ownership, she is also advocating for access to health care. And as part of our board of trustees for Harris Health, she's really just closing the loop on everything and anything that has to do with the health of an individual, which is really astonishing.
In the aftermath of COVID, I think we can all remember a time when mothers with newborns could not find formula on the shelves. It was literally in a crisis, and she spearheaded creative, incredible ways to source this formula for our mothers and their newborns, saving lives. So that's one thing that probably nobody realizes that she was behind.
The way she goes to bat for this community, the way she advocates for Harris Health as the only safety net hospital system for this community, those are attributes that make her so special, not just as a member of my board, but as a true advocate for Harris County and City of Houston. She is acting as a role model for me on how to care for this community.
She inspires all of us to ask ourselves, can I do more? Can I give more of myself?
My grandmother is my idol. She was one of the first women in Iran to become a congresswoman and help the women's right to vote, which was a big deal back then. And she also helped women who were being mistreated find housing, help them have an education. And I saw from the beginning how much advocacy matters, how important it is to empower women, and how important it is to give back to the community. So I've tried to live up to her expectations, and I hope she's looking down at me and she's proud.